We'll get started again. Those online said they find it really difficult to hear, so when you're speaking into your mic, can you bring it quite close? Computers. That's excellent. And we're now going to move on to item 7, financial local poverty action report. And that will be Sherry. So Sherry, thank you.
Yeah, thank you. So this report presents the Local Child Poverty Action Report for the period 2022-23. The report has been prepared in line with statutory reporting guidance set out in the legislation and associated guidance that goes alongside the legislation. It's been jointly developed with NHS North Valley with contributions from a wide range of additional partners from both public and voluntary sectors and right across services within Clackmannanshire Council as well. This report is the 5th Local Child Poverty Action Report that we have prepared, and it sets out activities and achievements throughout 2022-23 to mitigate the worst impacts from poverty and increases in cost of living for families in Clackmannanshire. The report aligns with the National Strategy Best Start Bright Futures, which was published in spring 22. Committee is asked to note that the report will be considered by the Alliance on the 1st of December, and the designed version will be published on our website thereafter. I'm happy to take any questions on the report, although there's a lot of detail and input from partners, so I may need to revert to colleagues. I was going to say this morning, but is it this afternoon? This afternoon.
Thank you. Which questions? Councillor Coyle?
Thanks, Chair. Page 92, talks about a range of programmes that seek to provide employability support, etc., etc. And also, I know there's a number of different organisations involved in that. Now, there is this point before, what concerns me greatly is overlap, and how do you avoid overlap? Because looking through some of the other reports, I noticed that the various ambitions were reported by a lot of different bodies. And if they're all trying to do the same thing, isn't there a possibility that we're putting too much resource into one thing and losing it somewhere else? So how do you control the overlap problem?
I'm not sure there is an overlap problem in terms of implementation of some of the work programmes. I know they're working really, really closely together. Perhaps where there is confusion is how that's being reported, and I do think maybe some of that employability programme progress has been reported across a number of different reports, and I think that is something going forward that would be beneficial for us to streamline, and Lorraine's keen to look at that as well, and it's in the report that that we would hope to do that. But Lorraine might want to come in on that point as well.
That's fine, thanks. Yeah, it would be my hope that it would make the reporting easier to understand as well. So perhaps I'm glad to do it.
Can I just come back on that quickly if I could? These are statutory reports, so we are required to report on them, but I do think there's something we can do that could be quite innovative in terms of how we're managing those reporting, but they are statutory reports, we are required to report in the way that we are doing across a variety of reports that you will be seeing and have seen over the last few months going to committee. But yeah, I just wanted to make that point.
Yes, this is something which is concerning me greatly, is the quantity of reporting. And there is a question on this. Do you think it's possible that at some point in the future, I know you have to do statutory reports, obviously you're required to do that, but we could have some kind of personal, local, condensed summary so that it's easier for us to understand the actual impacts of what the investments being spent. We can see numbers of, not necessarily numbers of pounds, but numbers of people, numbers of plans, or objectives. But do you think that's possible to get to some point like that in the future?
I would be delighted to see that, but I know Lorraine has been involved in discussions, so she might wish to come in on that. But yeah, I would be delighted to see.
ask if you're happy for me to come in and respond. So, yeah, as Cherie says, you know, I think all of us would like to see a much more streamlined reporting and planning actually framework that covered, because you're absolutely right, there is an overlap, and it takes quite a lot of work on our part to make sure that we don't trip each other up and that we don't duplicate. And there are processes in place for that, so the employability work is managed through the local employability partnership, and all of my officers sit in that, as well as officers from the various different parts. There's far too many groups, far too many plans. So the work that we've been doing in the background is to try and think, right, what are all the indicators across all the plans? Can we condense that into one overarching plan and then reference each individual statutory bit of that? And so instead of having about 30, I think at least, and I've got 12 that are very key to me, but there's others, as she says, that are statutory. So we could, but we're trying that with government because there's nobody else. I think the improvement service have looked at it, and the amount of reports that we have to put into government, but they haven't come up with a solution. So what we're trying to do is to prove to government that there's a simple way of doing this, and we're working on that.
Great. Thanks very much.
I have a couple of questions, just on the Right to Keep Well programme, which looks really great actually. It looks like it's really getting some good outcomes. I noticed there was only 28 people that had actually attended that programme, and I wondered if there's any plans to widen it out.
Thanks for that question. So the Thrive to Keep Well programme within NHS is a Valley Run programme, and I think it is designed given the women and people that are involved in that programme to keep that really quite small cohorts, quite small groups. It's very early, lots of barriers in people that we're engaging with through that programme. As far as I'm aware, there are plans to run further cohorts, but the numbers within each of those cohorts will be deliberately kept small.
I can come in on that because I'm quite a fan of the programme. It's been running for a number of years, and it is an NHS programme, and it's very specifically targeted, so it is small groups of women that kind of go through it, although it has been expanded to men over the last 2 years as well. And so we do really target them. It's almost like pre-employability kind of support and training. They hold an event every year, so maybe an idea to get you along with that and see in the future.
My other question really was linked to that. I noticed it was really great that you were making sure there was childcare available, or whoever NHS will make sure there was childcare available for that. But I was reflecting on when I looked through the employability work that's been done, which I think is amazing. I mean, that's going to be a real driver towards reduction of poverty. Are we looking at it strategically in terms of childcare for people who are maybe facing those barriers? It was on TV just a couple of days ago about people not being able to get back into employment because they couldn't get childcare that would meet their needs throughout a working day. So it was just to see if there was really a kind of work done strategically to tackle that along with the employability programmes.
Yeah, so if I could just add one thing to answer the question, we also resource fund into Thrive in terms of staffing, so it's not just NHS that funds Thrive. So we're an active partner in that. But in terms of childcare in relation to employment, we're very fortunate that Footmanager is one of the existing only 4 clients in Scotland that is funded to provide funded childcare, which with a direct aim of trying to get people back into employment. And at the moment that is only for school age primary 1 to primary 7, but we've just received notification that the government are happy for us to expand and put in a proposal to expand that right down to 2-year-olds, 9 months. In fact, actually 9 months to 2-year-olds expansion particularly, and then further into the early years, and then beyond along the south and east. And the aim of that is to provide parents and carers and grannies and whoever it may be that is providing childcare with the means to be able to look at training courses or employment. And we've had significant success with that already. From one of the Scottish ministers was out fairly recently listening to some of the stories from parents who are saying how either started their own business, have either been able to take on extra hours, actually got into employment. So yes, and the join up between ourselves and the employment team in place, back to Councillor Collins' point, I think has strengthened through that process. So we now have a child poverty coordinator funded by the employment money sitting within the family wellbeing partnership. So absolutely we are looking at it from a strategic overview as well as actually on the ground.
Thank you. Any questions? Councillor Collins?
Very quick one, I hope, just from my understanding, this is all about poverty, and we use the two definitions of poverty, persistent poverty. Can I guess what that is? What are the definitions of relative and absolute?
Yes.
Thank you, Councillor. I thought I might be asked that question, so I do have them up. So, relative poverty measures individuals with an income below 60% of the median income. So, very much based on income level. Absolute poverty is when household income falls below a certain level, which makes that family not be able to meet the basic needs of life, including housing, shelter, food, water, education and access to healthcare. So those are the definitions.
The second definition doesn't have a number on it, so what is that earning figure?
I don't think it's quantitative, I think it's a qualitative measure. It is essentially where families are not able to meet the basic requirements for filling a decent standard of life. Really, Councillor Collins.
Okay, I find that a bit strange. Because that means it's entirely subjective of who you include or don't include in your programmes. Who decides whether someone merits places in the programme on a basis of absolute poverty?
So those terms are mostly used for the Scottish Government in terms of how they are monitoring and reporting on poverty. I'm happy to go back and just double check those definitions. Those were the ones that I'd had up, but happy to go back and just have a look to see if there is a quantifiable against the absolute poverty. And again, there are 4 definitions of poverty, so I'm happy to provide those to you, Councillor.
Just to say, Councillor, that they are mainly used for statisticians and at national level, but when we're implementing programmes and deciding on eligibility, it's different. We're not looking at them. We don't ask for that kind of data to check whether somebody should get free childcare, for example. So I'm just trying to find them in front of me at the moment, but there's 5 or 6 categories. So it could be lone parents, it could be families that have a certain amount of benefits. So it's a fairly wide-reaching definition under best start features with the document that she mentioned at the beginning that we apply in terms of trying to make sure that we reach as many people as possible. And we don't take a very strict interpretation of that, but equally we can't just open the floodgates to everybody. The money has to be, we have to account for that money and to account for the activity. So although the definitions are there, we're not applying those in terms of the way that we apply the programmes and interventions.
Okay, again, you said median income. Do you mean median income or do you mean mean income?
The definition is median income, but again, I'm happy to go and get confirmed wording on the definitions of each of the 4 descriptions of poverty.
Well, that's fair. I just like when I'm talking to other people about it to have my facts right. So I'm guessing that from what Lorraine said, that you make the assessment of whether somebody's above or below line on a case-by-case basis with the evidence in front of you when you're visiting the scene. That's fine.
I have those definitions in front of me now, thanks to my colleague over there who's just emailed them to me. So absolute poverty is individuals living in households whose equalised income is 60%, is below 60% of inflation, adjusted UK median income, measure of whether those in the lowest income households are seeing their incomes rise in real terms. Relative poverty is individuals living in households where whose equalised income is below 60% of the UK median income in the same year.
That's fine. Sorry, it takes a long time.
Thanks, Chris.
Any questions?
Can I just ask for a follow-up on the back? Can I have your question? Yeah. So obviously the income figure is quite, I don't know, it's easy to measure, I guess. So I guess other programs are, like you say, it's not just based on the income. Is that because, it's not just the income? Dennis Street can have the same income, but I'm going to pay out the debt, and he's absolutely fine. That's going to obviously impact on the quality of life and able to provide, necessities and costs and stuff like that. So is that kind of why we're not really so that because there's other circumstances where somebody has something in the family that this is urgent and reduced costs, so the income doesn't necessarily reflect the level of outgoings as well.
Yes, thanks for your question. So I think the priority groups that are in the report, again, would be used for really prioritising those that quite a lot of research and information being provided on those being the groups of people in our population most impacted by poverty are large families with young children, families with a baby under the age of 1, families where there's a young mum involved in that family, so under the age of 25, one-parent families, families in which someone is disabled and or a child in that family, and families from an ethnic minority background. So those are the prioritised families that come directly from the national strategy, and we're required to make our focus on our poverty mitigation work around those families. The definitions, which are quite complex, are used for statistical purposes at a national level.
Page 111, a summary of advocacy work. It probably is in there somewhere, but I haven't found it. What are the notional savings? What does that represent?
I'm not able to answer that question if I don't have that detail. I'm happy to go back to the team who submitted that information to you.
Any other questions? No. It's also if you want to read the paper or involvement in it.
I'm happy to move the paper. Obviously, I'm a signatory to this as the leader of the council. And move forward ideas and drafts because I've been saying that up yet, so I made some changes to that. This report, as a statutory report, has already been highlighted, and it outlines the work that Manchester Council has undertaken along with its community planning partners to tackle child poverty in Manchester. So it's really important to point out that this isn't just Manchester Council's work. This is the health board, it's the police. It's fire services, third sector, all coming together to work on the priorities that we agreed as a community planning partnership. And the progress against the priorities is set out in the paper. I think the work that's been undertaken is quite significant. From a council perspective, initiatives like the Strive programme and the Family Wellbeing Partnership are really starting to drive forward initiatives within Manchester to make a difference. However, we are working on a national context. There is only so much Manchester Council and its partners can do to tackle child poverty because we don't have levers at our control, such as benefits or income or the minimum wage or inflation or all these sorts of issues. So we can only work with the tools that we've got within the powers that we've got, and I think we are making some good progress there. There's always more to do, I think, on these issues, and we should always be striving to do a bit more. I am convinced though that this is at the heart of the Alliance's and community planning partners' agenda. All the work that's been undertaken really does point to that. And although most councillors aren't members of the Alliance, if anyone's interested, then I would encourage you to kind of come along and attend the meetings, because this is where a lot of this stuff is discussed, and where a lot of the work between partners comes together, and it really just does highlight the scope of what's going on there. I think it's a good report. We just have to really, as agree it before it goes to the Alliance, and other partners will have to agree their bit of it. Some of these kind of churn reports that we'll probably see it at 4 or 5 meetings before we do finally, kind of sign it off. But there is a lot of good work there, and I kind of welcome the questions that have been asked, and hope people can support the work that's ongoing there. Thanks.
And I'm happy to second the paper. I was really encouraged to see the quality of work that's taking place in terms of, particularly in such a huge issue that we're dealing with at the moment across Scotland, actually, but to see the quality and range of work that's happening in the management area and all the different parts of that work and how it all joins together. It's not just sit there as segregated parts, it's all joining together as one sort of piece of work with all different areas. So again, I think that was an excellent report and I commend you for it, and thank you very much. So we're going to move on to debate. If anybody wants to debate the paper, Councillor Point.
Yeah, just to say that in reading the report, one thing that delighted me was the liberal use of numbers when it comes to outcomes. Not necessarily pounds, but numbers of people that have. That really gives one a lot of confidence. If you put those numbers down, then you can be challenged on them, and that's very good. It makes the report credible. And again, when it comes to the difficult time of allocating financing, that you've got to go really marked and can be defended. So yeah, very good paper, a lot of work done into it, hugely good effort in a very important area. So,
You have this little paper? Okay, thank you. Thank you. So now we move on to item 8 on the agenda, the Health and Safety Annual Report 2022-23. And we have Chris Allison coming to speak. Thank you, Chris.
Thank you, Chair. The paper as presented provides for committee noting and comment the annual report on health and safety performance across the Council for the financial year 22-23. As an employer and service provider, we have a legal duty to ensure the health and safety of our staff and anyone who may be affected by their work. The report presented highlights the broad range of operational work undertaken by our health and safety teams throughout 22-23, who also continue to be heavily involved in supporting the Council's recovery from the COVID-19 pandemic during that period. The work undertaken included the development of 6 new policies, completion of 597 health surveillance checks, 39 audit visits to council sites, and the delivery of a number of health and safety courses. The report also provides information on overall performance, including accident data, audits undertaken and training delivered, OH provision and uptake of the employee assistance programme, information on stress risk assessments conducted, as well as an overview of the priority areas for improvement. Committee are asked to note section 3.2 of the report, which outlines that during the reporting period there were 2 statutory breaches, one related to HARS and one for a ladder facing Kerry Lanark. These incidents attracted fees for intervention of 3,582, but through the work of our health and safety colleagues who work with the relevant service, improvement plans have been put in place, and the Council avoided more significant fines. The committee have also asked to note that there were no significant accidents or incidents that required HSE follow-up. The report overall shows the positive and critical work that our health and safety team continue to do to ensure our staff and service users are kept safe. The Council Health and Safety Manager, Team Leader, Workforce Development and Learning, and myself are happy to take any questions that continue.
Any questions? I can kick off actually. On page 154 on Employee Assistance Programme usage, I noticed that a large proportion of those who were accessing that, it was through a website rather than directly, and I just wondered if that was the choice of the individuals involved or whether that was what was available.
Yes, that is an individual choice. The website has a number of different resources that people can access at a time suitable to them. There is also a chat facility, so some people just feel more comfortable accessing your individual support through that chat facility rather than
making a phone call, which can be more difficult to do if you've got other things going on around you.
Yes, any questions? No, okay. So I'm happy to formally move the paper, and it's given us a high level of detail and information again to look at. I found it really interesting to read actually. I thought with all the different, as Dennis was talking about earlier with numbers, there's been some excellent use of sort of stats and numbers in this that really gives us a really good idea. And I was really encouraged to see the number of people who are actually accessing support on an ongoing basis. So that's really encouraging, and also that we are really, as I alluded to earlier on, the kind of health and safety risk assessment and training that we're trying to move forward on that. We covered that in the previous papers, so I think that's really helpful, so thank you. And you're happy to second the paper? Probably second. We're open to debate. Anyone wants to debate the paper? No? Okay, happy to vote the paper? Okay, thank you. Thanks very much. And now move on to item 9 on the agenda, the Council Financial Performance 23-24 as of June 2023, and that will be presented by Lindsay Simon. Thank you.
Thank you. So this paper provides an update on financial performance for the Council for the year ended 31st March 2024, based on actual spend for the first quarter to June. The general fund revenue is forecasting an underspend of 0.6 million for the year. Of this underspend, 272,000 relates to the World Schools, which is earmarked for 24-25 in line with the academic year. A summary of the position across the directorates is provided in Appendix 1, with full details spent by service area provided in Appendices 3 to 6. The CLAP management element for the Health and Social Care Partnership is forecasting an overspend for the year of 3.4 million. This is based on information for the first quarter. This contributes to the forecasted overspend of 7.2 million for the partnership in total. A recovery plan is therefore required when the partnership in line with budget by the end of the financial year. If this is not achievable, the Council may need to contribute additional funds in line with which year is set out in the integration scheme. The General Fund Capital Programme is forecasting an underspend of 1.1 million across various projects against the revised approved budget of 25.8 million. A summary of the forecast per asset plan is provided at section 6.3 of the report, and detail by project is provided in Appendix 10. The housing revenue account is forecasting a surplus of 3.3 million, which is 550,000 below the budgeted surplus. The HRA capital programme is forecasting an underspend of 1.5 million. Details of the HRA revenue and capital forecasts are provided in Appendices 8 and 9. In relation to savings, the Council is forecast to deliver 2.6 million of the approved 3.8 million, which equates to 68%. A further 1 million is identified as at risk, with the remaining 176,000 indicated unachievable. Details of the individual savings are included in Appendix 2, and services are looking to try and identify additional savings so that this isn't a loss against the budget. Happy to answer any questions on paper.
Yeah, my question is around the overspend in the Health and Social Care Partnership and the state and environmental scheme there. Obviously that's quite a significant overspend, and as Lindsay's just said, the council could be asked to contribute to that overspend. Now, as a council, whenever there's an overspend in our budgets, as laid out in this report, we get the chance to see exactly what the overspend is for, and what steps have been taken to kind of bring it back in. We have a bit of influence kind of over it. I don't feel that we kind of have had that in relation to kind of what's been reported in this overspend. So I suppose the question I'm asking is, when will, as councillors, we receive that information to allow us to provide scrutiny over that, and I suppose moving forward to decide whether we would be kind of contributing, because it's quite a significant amount of funding. And I think it's our job really to kind of drill down on that, just to make sure that what's happening really is in the best interest of the manager.
Okay, and Margaret, do you want to come in?
Yes, Councillor Rennie. Thanks very much. Can people hear me okay? Yeah, thank you. So as Councillor Forson is saying, absolutely social care is the responsibility of Clyde Manager Council, and adult social care have been delegated into the Health and Social Care Partnership, and the Health and Social Care Partnership is a partnership between Clyde Manager Council, Stirling Council and NHS Forth Valley. So I absolutely agree that there should be an interest in this budget. So just the context of this is that the IJB passed through all of the funding to Clyde Manager Council that was originally allocated. And this was to deliver, as you know, adult social work and social care service for some of the most vulnerable people that are living across Clyde Manager communities. We offer support to about 800 people that have got various vulnerabilities like learning disabilities, complex needs, supporting people at home. And I'm just checking the numbers for the people that are living across care homes that the council fund as well. And we're trying to develop a data set so that we can readily get that activity data to you, because that will be something you'll want to know as well, exactly what is this money buying. So in terms of what is driving the demand that's resulted in this predicted overspending, as Lindsay said, this is a Q1 projection. We're operating just now in a post-pandemic world, and there is a range of vulnerabilities that have emerged as a direct result of the pandemic. And also, it won't be any surprise to people that we've got a national crisis as it relates to social care, both from a workforce perspective and from a finance perspective. The actual drivers for demand is that we've seen an increase in demand for care at home services. We have seen an increase in demand for residential care, nursing homes, and this is detailed at Appendix 7 of Lindsay's report. And some of that detail is also in the body of the report itself. We've also had inflationary pressures. We've had pressures on recruiting temporary workforce where our staff have been off sick, or we've just not been able to fill vacancies. And of course, as I said at the outset, we've got the legacy of COVID. Another cost pressure is that you might remember, the elected members as part of the council might remember that Clyde Manager Council didn't pass across the pay uplifts for adult social care that were passed through to the council by the Scottish Government, and that adds to the pressure and the savings requirement of at least an additional £206,000, but the actual costs are beyond that. So this has absolutely driven the requirement for additional savings as well. That forms part of this overspend. We've also had issues about management and leadership turnover, and I've commissioned a bit of work on management and leadership capacity to drive forward any changes that are required to get us basically on the implementation of the savings proposals, and I'll say a wee bit more about that later on. But I just also wanted to mention the wider integrated budget. So, and I'll tell you at the end why I'm bringing this to your attention specifically. So the integrated budget is predicting a 4.7 million overspend on prescribing, and the national data set that lets us know what Clyde Manager and Stirling are consuming in terms of prescriptions, volumes of prescriptions, and the number of prescriptions, it's 5 months behind. So Ewan and the team have done some projections on what that will look like at the year end, and we're currently predicting it would be a 4.7 million overspend. And that aside, we've also got the set aside budget that pays for large hospital services. So this is any demand that's in an acute hospital where that comes from an unscheduled care route, and that's predicting a £5.8 million overspend, which is part of the integrated budget as well, but the Health Board pick up the risks for that particular part. The reason that that is being predicted at 5.8 million is that there has been a significant issue with opening up contingency beds because there's been whole system pressures, and the staff required to actually staff those beds has been significant, but the Health Board are working on an improvement plan to address all of that. We've also been addressing unmet needs for people that are living in their own homes, but also people that require discharge from hospital. And that helps, that early intervention helps people retain independence and get better outcomes. However, we've still got a lot of unmet needs in the community for people that are awaiting assessment. There's also been an increased activity in adult support and protection, and an increased vulnerability of people that are being referred to as, for example, people with strokes that require 2 personal carers in their own home, and some of the people within the care group areas that I'd mentioned previously. So whole systems pressures continue. Part of the issue that we've had on an ongoing basis because of the workforce crisis that we've been experiencing is that our reablement teams that usually go in and do a piece of rapid reablement work with people in their own homes, that caseload has been silted up with delivering personal care to people, because we've really struggled, particularly at the beginning of the financial year, to get commission provision for that. So that has made our model of care much less efficient and productive than what it would be. But as I say, we have we have been identifying more capacity, which means that our reablement teams are going to be, working for greater independence with people that we're here to serve, but also to make this as efficient as we can with as least hours as we can that will meet people's needs. So at this point, you want to know about how we're going to address those cost pressures going into next year. So we have got lots of ideas that have been worked up into options, and we're going to progress the detail of these, and we're also going to be engaging with the council budget setting process so that the councillors can see what's in those options and what there'd be an appetite for and what there'd be absolutely not an appetite for. So finally, so I'm not planning to go through all of the detail with that as well, but just to say that we are working on that, and we have some good ideas about that. So finally, on the 3.4 million predicted overspend for 23-24 is detailed in this paper. So Lindsay is saying this is the Q1 report. However, the IJB made a decision at its last meeting in September around addressing this overspend that has not been included in the paper that you're considering today. The IJB's agreed to use non-recurring reserves for 23-24 to cover that overspend for Clackmannanshire Council and for the other bodies that are involved in the partnership. But that means using non-recurring this year is going to put us under more pressure next year to deliver a bigger savings challenge. So it's unlikely Clackmannanshire, to reassure you, it's unlikely that Clackmannanshire Council are going to have to invest in the risk sharing agreement this year, but that is based on the projection that Ewan and the teams have done round about prescribing landing at the overspend that I'd said at the beginning, which is the £4.7 million. So we need to keep a close eye on that. So at this point in time, if everything goes right with the projections, Clackmannanshire won't have to put any money in to cover that overspend. But again, I'm saying that with the caveat that those projections need to come in as is or come in under what we've predicted. So I hope that's helpful and it reassures that the audit committee, that the IGB is supporting the council as far as possible with the cost pressures, and the officers have commenced the process of savings options, which potentially will include service reductions as well as cost control options. I hope that's helpful, committee. Thanks, Chair.
Okay, thank you. Ewan, will you want to come in as well?
Thank you. Just to maybe helpful to explain just a wee bit more around the process of the integration scheme, as Lindsay sets out in a report for projecting an overspend on the integrated budget, a financial recovery plan is required. We took a financial recovery plan in part to the September IGB after taking it through committee, which would reduce that overall £7.2 million overspend to just under 3 million overspend. That was also predicated on we were left with a further residual balance of Scottish Government COVID funding, which I now have agreement on with government. That's about £200,000 less of an impact than I assumed in that paper, which would take us to about 3.1 million net overspend. The integration scheme then requires us to look at the IGB's reserves, and at the moment, based on that trajectory, and while we're trying to improve that trajectory, the IGB's general reserves, which sit just over £4 million, would be the first call on that overspend. So hence that's why, based on best information we have at this point in time, we don't think there would be a potential risk to the council this financial year. Going forward, that risk is only increasing unless we find sustainable solutions to deliver in social care, and that's going to take some really difficult decisions going forward that obviously the council as key partners need to be part of the considerations around some of that. Hope that's helpful. Thank you.
Yeah, just a follow-up. That was quite helpful because obviously we are partners in this, and operationally, probably as councillors we have less kind of oversight and say over, you know, kind of how we run that line with the IGB and not look at manager council. Because I know for departments within the council, we can say, well, we're putting a spending freeze on, or you know, we're not doing that, but we don't have that power as councillors. What I would say, I'm understanding there's a recovery plan being brought forward to, you know, kind of address the overspends, and that would probably be, I don't know if it's been agreed by the IGB or whether it's still to be agreed, but I'm just wondering, can that recovery plan be brought to this committee to allow us to scrutinise it also?
Thanks. I'll pick that question up. So, per the integration scheme, it requires to go to the IGB first, but then it's a public domain document. But I would encourage, the issues are so difficult that I do think we do need the widest engagement, including through each of the partners' budget setting arrangements, because while there are things we can still do to make services more efficient, more cost effective, including some of the issues you've referred to in the committee already in relation to the other services the council provides, including seeing higher sickness rates and the costs associated with that and such like. Those efficiency measures and transformation measures alone are not going to sustain services given the level of recurrent financial challenge we are likely to have going forward. So it is key that engagement across all the partners is incorporated in all the planning going forward. So I would encourage as wide engagement around those issues as possible.
Any other questions? I'm happy to formally move the paper. I realise the amount of work that goes behind paper such as this, and you're just getting the sort of headline figures, and I realise there's a huge amount of work from everybody involved, so thank you very much for that, and I'm happy to formally move the paper.
Sorry, I didn't realise.
Yeah,
Well, I did, yeah. May I ask it?
sure.
Generally, are the quarter one figures a good tell-tale of the rest of the year, or not? In other words, is this as bad as it will get, or could it get worse?
Answer the second part of the question, it could get worse, it could get better. But the projections that do are obviously very early, because they're looking at very short amount of time for the data. And as we get through the year, obviously we see more happening, so we get a bit more information on forecasts, so we update them. So the trend has been in previous years as a council that any overspend is reduced, but that's a consequence of both management action as well as what we're seeing just through the demand, etc. Because we see that overspend, services will then look to manage that overspend down and implement the budget. So it's a good indicator in terms of alerting of areas of potential overspend and where the action needs to be taken to bring that overspend down. But there are obviously things that come in through the year that we've not been expecting that would impact that as well.
Thank you, that answers that question. I've raised this with you before when we talked about underspends, and they fall into two broad categories, which are delayed spending and recurrent also spending. And it makes a huge difference which one we're talking about. So I feel that to lump them together, just single 602,000 figure, doesn't really represent the risk element to reading the papers. You look at that at Translate, we've got that £602,000 there of underspend. That's good. That may not be good, they just delayed expenditure. And if it's delayed expenditure, that's a good stretch of next year's budget. So we don't want to spend that, or take recovery action, or not take recovery actions because we think we've got this up our sleeve. And that's what worries me slightly, is that if we just look at the gross overspend figure rather than the actual recovered spending, if you get my drift. Is that possible? I think it said yes, we can say that.
Yeah, it's quite difficult, and one of the things that we probably do a bit better in the capital side is we look at the underspends and the delays. So where it's a delay to a project which is the most likely occurrence, we look to carry forward into the next year and review it to have the overall budget for the next year. In terms of revenue, it's a bit more. It's not as identifiable when you look through it, so it's something we could try and look at. It's probably not as well defined though in terms of the work. So because it's not specific projects, it's difficult to say that we're delaying something. It will work for some areas, but not for others. Like a lot of the underspend falls within staffing. So we've got underspend in staffing, and some of that will equate to where work has been delayed, and you can see that through other reports, and others will just be a matter of us trying to cope with the capacity that we've got in the service. So I suppose all I can say is that we can try and look, when we're speaking to managers, to try and highlight areas of underspends that is causing a delay, or whether it's not that, it's a true underspend, so we don't need the budget.
That would be helpful, thank you. And I think Kevin will cover my HSCP. Yeah, the question on the electricity, I think there's no McDonald's areas.
Apologies, Councillor Cook, if you perhaps switch your microphone, please.
Usually very loud, is it? Yeah, on page 175, the very last item, replace environment, it says transition to net zero, see appendix E, electric vehicle charging policy. I take it as appendix E in the electric vehicle charging policy. I'm just wondering why there's an explanation for the at-risk and of 120 and the unachieved 40,000. What went wrong in our plans to recover all the costs?
I'll just start, the reference to appendix E was because this was a straight work out the budget paper, so it's appendix E to the budget paper, so apologies for that. I'm not sure if we have people in it online who might be able to give an update on that particular saving.
Yes, hello, Chair. Can you hear me okay?
Yep.
Okay, so we've got arrangements in place. The charges are now in place. We have a mechanism, the provider that manages all of the various charges has got a mechanism in place. We just need to do a little bit more diligence to find out where the income is coming in, and so we can evidence the income that we're receiving and making sure that that matches up to the funding that the saving that we anticipated. So just a little bit more work to do before we can get that clarification.
So if I can, excuse me, if I can back on that one then, is that the worst it's going to get because you've been aware of it since June? And have you identified those problems in between times? Or is that Q1 going to be multiplied by 4? Or is that a projection to the end of the year? That must be a projection to the end of the year, mustn't it?
Yeah, I can't really answer that question at this.
Asked it badly. Is that because I asked the question badly?
Sorry, Councillor, I didn't quite catch the full question.
I'll rephrase it. When you've looked at the figure of 160,000 as at-risk and unachievable savings on the EV cost recovery programme, is that what you've incurred up to the end of Q1, but don't expect there to be further problems because you're on top of whatever it was you were on top of in managing the process?
So the quantum of 160 is what we anticipated we would receive based on cost recovery and what it was costing us for the energy and what the charges would, in theory, deliver in terms of a saving. What we're trying to figure out now is how the saving is appearing on our books. So we've got our energy, well, this is a transport initiative, our energy costs come through the property team, and also we're just trying to figure out the detail of how we're being charged by the provider against that account. So we need to do more diligence to find out where the money's flowing in. So it's not a question of we don't think it's achievable. At this stage, we're just trying to find the actual detail of where the income is coming into the account so we can measure it.
Okay, when do you expect to have a clearer view on this then?
Certainly by the time we have a next report to committee.
Okay, thanks.
I'll just add a wee bit more information to that. So we only started charging for the electric vehicle charging points at the end of July. So this is based on June data, so we haven't actually had the information of what income we've been generating through the charging from the electric vehicle charging points at this time. So that's what Pete's referring to, so we've not had that data yet as to how much income we're generating. So once we'll get a better feel for that September, but actually it might be towards December outcomes to we get more of a feel about how much income we're generating, and we can give a better update on this event.
Thanks, that's a lot.
Yeah, so again, I'll just formally move the paper. Is anybody happy to second? Okay, thank you. Stuart has a suggestion before we move to debate.
Yeah, thanks, Chair. I was picking up to some extent a desire for the committee to further scrutinise the issues that were coming from the issues about the overspend in Carmarthenshire and personal health and social care. So I just wondered if it was suggested I pick up with Lindsay, you and Anna Margaret and just think about how we might bring forward a paper, whether it was supplementary to the next outcome or it was a separate paper, but if I just wanted that one looked at, if that would be acceptable to the committee.
So that's very good, thanks Stuart. Did you like to debate in the paper? No, you're happy to know the paper? Okay. So the next paper is item 10, internal audit progress report, thanks to Lindsay and colleagues. So we'll move to internal audit progress report, and the report will be presented by Sarah McPhee, internal audit. Sarah available online? Thanks Sarah.
Hi, thank you. This paper is to provide an update on the progress of work on the 23-24 audit plan. The plan contains 16 assignments with 11 audit reports to be completed, and there was also one report that was still to be finalised from 22-23. Appendix 3, you'll note, details the audit report was completed and has now been issued as final, so this concludes all the 22-23 outstanding audits. Appendix 3 details all the 16 assignments on the current 23-24 plan and the progress thereof. So in summary, there's 5 assignments in progress and 4 ongoing. The ongoing ones tends to be the likes of NFI, or duplicates, which have no clear end date. They are continually working through the year. Our 6 monthly duplicate creditor payment work has been completed for the period the 1st of April to the 25th of September. This checks for any duplicate payments with matches to payment amounts, invoice reference numbers and supplier details. The review resulted in 7 duplicates identified, which represents 0.035% of the total payments made in the period. So to conclude, 23-24 audit work is progressing well and on schedule. I'm happy to take any questions you might have.
Thanks very much. Any questions from anybody? Councillor Boyd?
Yes, thanks. Page 194 at the very top, you're talking about the payments, the overpayments, duplicate payments, and what's that's right. Was that concentrated in a small number of transactions, or was it spread over a whole raft of different areas in the council?
We get a detailed breakdown from your Tech One system, which is your finance system, and we run it through our own software in-house, and that produces any duplicate payments based on the criteria I'd mentioned. So it's covering every payment within your organisation.
Yeah, it wasn't the coverage so much that I was concerned about, it was the actual infringements. Were they localised or were they widely spread? And in other words, are we learning something from this? What's happened? Why these are occurring?
Oh, sorry, I misunderstood your question there. There's no particular area that's confined to, sorry. It literally is just spread over everything. Most of them have just been a user error of somebody mistyping in an invoice number, or genuinely the supplier didn't know they'd sent in something. We do highlight there's duplicates for legitimate reasons as well. So there isn't any template that this, or any pattern this is following.
Thank you. I see that action is ongoing to recover these overpayments. I know it's not a big sum, but every penny counts these days. Do you expect any problems in the recovery?
We leave that down to the finance department to recover, and they will tend to try and get credit notes of the next invoice that's due, or we'll look for reimbursement as well.
Well, the councillor point, perhaps Lindsay could just come in on that, because it's a service that looks after that aspect.
Thank you. Yeah, so once the duplicates have identified, the team will look through to see what the reasons are, and as I said, sometimes it could be an invoice number that's been keyed differently. So we contact the supplier in each of the cases and request that the refund is made. So we've got that, and we keep that monitored to make sure that we're getting that. And it usually happens through the credit note or a discount on the next invoice. So we've got a note of that.
Would actually make the overpayment worse. I invoice you for £100 and I pay you 200, and you give me a credit note for £20, then that means I'm paying even less, and due money back from you. So credit note's not the answer.
Supply and capacity.
Yes, that's not an issue.
A reduction on our next payment.
That's also a key over signature.
Any other questions? Okay. I'm happy to formally move the paper, and thanks very much to Sarah for the excellent work on this that you're continuing to do. Sorry, yeah. Mr. Forson, thank you. And now we're open to debate. If anybody wants to debate the paper? No. We're moving on to item 11. I wondered if anybody wanted another break or whether you were okay just to continue. Just continue.
Yeah, well,
Oh, sorry, we have to vote. Yes. Get to that stage now. So we're on item 11, corporate risk register, and it is Stuart's presenting.
Okay, thank you, Chair. This is a regular standard report which will be familiar to members. Appendix A outlines key changes to the industrial unrest in the context of pay settlement and issues around the ICT infrastructure and cyber security. The latter is a combination of increased threat actors and activity and issues associated with legacy systems. We have a considerable programme in support on infrastructure and modernisation ongoing and awareness campaign on cyber security on the basis that 30% of that is about securing infrastructure and 78% is about awareness and people making sure that they are following good practice in that area. I'm happy to take any questions. Chair?
Do you have any questions?
Stuart, I think really answer this, but there's kind of a lot of reds and ambers there, much more than the greens and probably that we've seen in a while. Is this standard now across most local authorities to be reporting on this sort of picture? Because I'm looking at this and it seems to me that there are a lot there that's out with our control, that we really can't kind of, I suppose, kind of solve the risks on.
Yeah, I mean, I think the reds and ambers that we have there are familiar friends, unfortunately, and some have moved up from amber, a few have moved as well. So industrial and rest of the green the last 10 years up to amber, so that is somewhat moving feast in the current context. I mean, things like financial resilience have been at red for as long as I can remember, possibly going back as long as 10 years. So yeah, I think health and safety has actually moved up. That was an number has moved up. So I think we've talked previously, or questioned previously at committee on this about a lack of movement. I think there are ongoing strains in the system around resources, etc., which is one aspect of it. But I think that there is quite a lot of uncertainty in the external environment. On your specific question about is this the same for other councils, I'd be more than happy to look at that, just try and get a sense of whether that is the same or not, because I've probably just be guessing at that. So I think I'd be happy to take a come back with I can be sensible that's looking at across the piece at the next committee. But yeah, there are certain areas in here that are really just have been sitting at red, and some of that is not within it. So if you're looking at something like supply chain and labour market disruption, that is impacted on virtually every single public service and wider. So difficult to see at this stage of the game what we can do on the wider scheme of things, but there are lots of little things that we can do. So we talk about, for example, apprenticeship schemes, graduate schemes, and we are looking at all that for the workforce. So there's things that we can do, but whether that is like poverty debate, there's things that we are doing, but with the wider impacts is it enough? So I'll certainly undertake to come back and I'll leave an analysis to try and give the committee a sense of whether it's just us or whether it's whether being overly pessimistic in the scheme of the wider local government in Scotland.
Judith, would you want to commence?
Yeah, I was just going to say that it's noted in the summary of changes that there's frequently fewer greens on the corporate register, purely because these are our biggest concerns. So a lot of the time those would be demoted to the directorate or service registers if they are less severe at the corporate level. And also just to say that we do quite a lot of peer review with the risk logs with other authorities, particularly the Health and Care Partnership Risk Forum. We also look at the Alarm Scotland registers and do a lot of communication with them, you know, just on the big issues at the time. And also things like the Local Government in Scotland the Local Government in Scotland overview from Audit Scotland. I'll review that with a risk hat on, thinking obviously about the particular risk implications of those reports.
Thank you very much, Judith. I have a question as well, just in terms of, I think we've been sort of through a process today in terms of looks at health and safety, like we began to attend. And on health and safety page, which you did mention, had kind of moved up. Just in terms of the paper that we brought today in terms of health and safety and the planning in place, will that help move that to a different level?
Yeah, I think there have been ongoing issues about making sure that we are getting things like training done and things like risk assessment. So it's quite frustrating actually when we're looking at reports that are reporting from the year end and 31st of March, because we know that there has been a lot of effort, particularly around the risk assessment. So there's been a huge push on that and also mandatory training. So I would be confident that as we move into the next cycle that we'll start to see quite a shift in that, because there's been a lot of managerial focus on that area given the statutory responsibility and personal liabilities and responsibilities that come with that.
Thank you. Let's talk about insufficient pace and scale of organisational transformation. What concerns me is the high score. It's not obviously a major impact, we can take that as read, but it's the likelihood, which is up at second top level. And that worries me slightly, that if we are admitting that there's a likelihood, a high likelihood of this endeavour crashing, and then we should be doing something about it to alter the rate of change. Maybe we're trying to do too much at one time and we're overheating on this. Is that a possible risk? Is that a possible truth?
Yes, the complexity around this is I always have to sort of bring this analogy. It's a bit like a boxer being in a corner when they're getting pummeled. And you're in the corner of the ring and you can put your guard up, and that will stop you taking the head blow or the killer punch to the abdomen that's going to knock you out. So to some extent you've got to get the head up and get the gloves out and give it a go and punch your way through that. I don't know if that's a good analogy or not. But so, yeah, I mean, there's a lot happening in that external environment. There is a lot happening in transformation. There are wider issues around financial constraint. We've heard that every partner that's been in the room today is talking about that, and that's obviously overlaying that. Overlaying that is also issues with recruitment and retention, which also, so I think it's very, very complex, and it's almost in some ways you can run quite hard, but the environment is changing and it's very, very uncertain at the moment. Are we doing too much? I think if you were to look, for example, at the capital programme, you can maybe make that argument because it's underspending, and I think over time we're trying to make sure that's more focused, on fewer priorities, on clearer priorities. So I think that's a work in progress. I think also transformation is over the pieces has become much tighter and clearer in terms of those priorities. So it's perhaps remains a work in progress when you set a plan, and you may anticipate that you've got certain resources at your disposal, and then as that plan is executed and those resources aren't quite there, or you've got turnover or something, that obviously gets in the way. So whether you can afford not to endeavour is a matter of debate, I suppose. But I don't have an answer to that one. If I did, I'd probably make it a lot of money as a management consultant, I suppose. But can you afford not to continue to endeavour to deal with priorities that we're focusing on? I suggest probably not. In terms of the way that we manage that, we've got to be realistic perhaps, might be a case in point, but I'll certainly reflect on that with the management team. We can maybe think about how we reflect that through into this particular risk as a case in point. Just conscious that as the Chief Executive now, it's on my heart, so I wouldn't want to steal our thunder, and I'm certainly want to be involved in the response.
But I ask you this: do you think it's a reasonable approach to transformation, to change, is to look at where you're having greater success and the transformation is happening more quickly, and on the other areas where it's dragging its feet a little bit, that you may be putting too much resource into trying to improve the rate of the dragging rate? Maybe you could leave that until you're in a stronger position and focus more on areas that are well greased, well oiled, and are moving quickly. Because during the transformation process, the operator has to use two machines, has to ride two horses, he's to ride at the same time. And that's stressful because you need to make sure the new bit works before you give up the old. So the quicker the transformation process can be achieved over the shortest interval, then obviously that's the way to go. But there will be transformation processes where you're tying up resources for a long time because it's a difficult changeover. So it comes down to prioritisation. Are you looking at the prioritisation of transformation across the board in that kind of light?
I'm thinking back to the management degree in world class engineering, where you're probably working in a sterile environment, and some of the variables are less so than we have at the moment. So I think we are continually looking at that. I think the council is continually refining their priorities. We went into the community last year and they agreed that the priorities that are in that transformation programme are there. I think there is a consensus that those areas are the right areas to focus on. I think the difficulties that we've got, and perhaps not articulating that, is that they're particularly well, is that we are not working in an environment whereby it might be that can be sterile factory environment where we can make a twist on that dial and it may continually seek to get that improvement. I think what we're seeing is a deterioration in an economic situation which is hitting on some of the most vulnerable in society, and for us those are a good proportion of our client groups at a time where our resources are constrained and also where inflation is hitting on. So it's a very, very complex process, but I think there is a huge amount of consensus about what we're focusing on. I think, and inevitably, in every year, when we're looking at the capital plan, when we're looking at our transformation, when we're looking at our business plans, are we doing too much? Is there different ways we can do it? I think we're looking at that, but at the same time, there are statutory duties that have to be met, there are statutory targets that have to be met. There's been quite a few here today, so it's such a complex area and changing in so many different facets at any one time. It's quite difficult to answer, perhaps, in the way that you're suggesting. But I think we're continually looking at it on an ongoing basis.
Any other questions? Okay, thank you. Well, I'm happy to formally move the paper. I think we've had quite a bit of discussion about the paper and how we would like to see movement in it, and I think we're seeing that clearly here where the paper's been well regarded and looked at again, which I think is of great benefit, so happy to move that. Can I have a seconder, please? Councillor Coyne, happy to second. Do anybody want to debate the paper? No? You're happy to accept the paper? We'll move on to item 12, exceptions from the application of contract standing orders, and that is Stuart again.
Thanks, Chair. Introductory remarks brief. It's a standard report on exceptions granted by me since last committee. These are set out in the report, but I'll free them, and Derek and I will be happy to answer any questions that members may have on those exceptions.
Did you have any questions? No. Okay, I'm happy to formally move the report. MD happy to second. Principal Forson. MD like to debate. No. So happy to formally vote. Thank you. Now we'll go to item 13, regulation of investigatory powers Scotland Act 2000, and that is me.
Thanks, Chair. This report updates the Committee on the Council's use of the Regulation of Investigatory Powers Scotland Act, in short RIPSA, by Representative of Investigatory Powers Commission's Office, ADHOC. In certain limited circumstances, it may be necessary for the Council officers, in the course of their duties, to make observations of a person in a covert manner, which is basically without the person's knowledge. Such actions may potentially be deemed intrusive and may give risk to legal challenge. RIPSA was introduced to make sure that such surveillance was properly regulated and to ensure compliance with human rights legislation. There are statutory codes of practice which sit alongside the Act. The Council has a RIPSA policy in place along with staff guidance and standard forms which are required to be completed and authorised by authorising officers who are the Chief Executive and the three directors. The Council is subject to an inspection of RIPSA powers every 3 years. The next inspection is the 4th of June 2022. I would ask the committee to note that no authorisation has been granted by the Council under RIPSA since last inspection.
Thanks very much, ladies and gentlemen. Any questions? No. Thank you. I'm happy to formally move the paper. Councillor Flynn, happy to second. Very happy to move the paper. Okay, on to item 14. So the Audit and Scrutiny Committee annual report and forward planning 2023-24 last and certainly not least with the work that's going into this. So I'll put that over to Stuart.
Thank you, Chair. This report follows committee development work and seeks agreement on priority support for development. Appendix 1 outlines the basis of that work, which included a review of the committee's forward plan to ensure that it's complete and cover the scope, the remit of the committee skills audit and self-evaluation against the CIPA audit code. This work has led to a number of actions that were committed to me under the development programme, which includes training requirements, some of which actually are already in training, as we alluded to earlier in the meeting. A key next step will be for me to prepare a report for the Chair to submit to Council on the committee's suitability and capacity to discharge the role remitted to it by Council. It is intended that this assurance process is repeated each year in the spirit of continuous improvement. I'm happy to take any questions, Chair.
Is there any questions? I'm very happy to move the paper and I'm happy to second. Okay, would anybody like to read the paper? I'm happy to move the paper. Okay. Well, that brings the business to an end today. The meeting is now concluded and the recording will be stopped. So thanks to everybody today for coming along. It's been a long meeting, so thanks for your patience. And come on, so thank you.